go live. So supposedly, okay. Let me just check here really quick to see if it's live. Is it live? No.
Did you start?
I think so, but I'm just double check. And
Where should I go?
it's, I don't know why I cannot push it on this. Okay, so I know we are live on YouTube, but for Instagram, it's like, it seems like it's not going on. But I think there's one thing I could do, but I think it's fine because in any case, we can keep this video and then we can do a rerun as a live streaming on Instagram later on. So don't worry about that. But I think we can just like go ahead and get started.
Yeah. Okay.
Yeah. So I think I'm so happy that Elizabeth, you are able to join us today because I know like we talked with you a couple weeks ago, and then I know that you don't need to do this. Like you have a lot of clients. You have been in the field for more than 40 years, working with cancer patients and all the other patients that's going through very deep trauma and a lot of personal like setbacks, and that you are just like, because we reach out to you, so like to share about breast cancer, and it is because of this topic you feel like you want to share more, and I'm very honored that you said yes to this.
Yeah. I don't think we can talk about it enough.
And
Yes.
And reach the patients, their families, their partners, their children, because the stories are what connect us and make this disease process real.
And like Lisbeth, like you have tons of experience. So just to give everyone an intro, so you not only personally, but like also like you have like more than 40 years of like experience working with cancer patients, and you let's see, I'm looking at this, and you like as a psychotherapist and a consultant, and you also like not only working like very closely, seems like with like the doctors and who refers patients to you, and then you work with patients via different stages of their life, from just discovering it to like even for a couple cases that's going through the end of their life, and that like that has a lot of impact on yourself as well, and you are very openly like experiencing all that and opening up to us about like your personal experience. And also you share about there's so many toolkits that you work with, like you have just reading your website, the EMDRs and neurobiology, you work with dreams, immigration, points of view, there's so much toolkits that you work with. Yeah, and this is awesome stuff.
Thank you. Um, let me start with a story. I think that what is always helpful is that each woman and man um, can tell their story. Breast cancer does not belong just to women. Um, Many men also um, are diagnosed with breast cancer, and that it's an initiation, is the way that I see it. That all of a sudden, the ground of your being is quite different once you get that diagnosis. And from the moment that you either feel a lump or you have a mammogram, um, or something is not going well in your body, your system, something just feels off, um, your life changes. And oftentimes it's filled with a lot of fear. What will happen? And for some, it's like, not now. No, no, not this is not the right time for that or for this. So there's just a couple stories I think I want to start with, is a recent diagnosis with a dear friend of mine that came out of the blue, is that she was at 79 having a lot of night sweats, something that she was sure that she was completely through in her lifetime, and that she had taken hormones earlier on in her menopausal years, but had stopped. And these night sweats were just bothering her, because she'd wake up completely drenched. And so she decided to give her gynecologist a call and say, I'm really considering wanting to be back on hormones because I'm having these incredible night sweats. And
Mhm.
so that was, the beginning of 1 week. And her physician said, well, let's meet, but let's have, a mammogram first. It had been a couple years since she'd had her mammogram. Sometimes when you're older, you're not thinking about this anymore.
Mhm.
And so she went in for her mammogram, and then she got a phone call, come back. We want to do another one. And actually, while you're here, let's do an ultrasound. And then they had found many little dots of cancer. And within 10 days, she had had a mastectomy at 79. Total, complete shock.
Yeah.
Going, how does this happen? So she just felt like she just got slapped, and it was very rapid. There were oftentimes when breast is taken. Also, we have nodes, lymph nodes that are also taken, which
Mhm.
sometimes is more painful than the mastectomy. What
Yeah.
she said is she's just blown away with how long the scar is around her back and up through, underneath her rib cage. And so she's still, it's been about a month, and
Mhm.
she feels extraordinarily lonely. She's still in shock. She says, how did this happen? I don't understand it. And then, like many of the stories that I have heard and know about, during this time, she found out that her mother's sister, her aunt, had had breast cancer and was never told. So nobody knew about it, that there was breast
Yeah.
cancer. So when you talk about the secrecy that happens, it happens within families, that there may be a family history and it's not told. So
Yeah.
that the next generation of women and men,
Could be affected. Yeah. 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 Yeah.
don't have a chance for the genetic testing.
And that's so much like what you just shared. It's like someone who is at their 70s getting diagnosis with breast cancer and having to still go through this, finding out that they have a family history about this, like that she never know. So there's a huge silence about, like, nobody talks about this topic, and then like she herself have to go through like the physical change, the emotional change of discovering that this is like so much to take on, like at the
Right.
age was like even 70 years old, 70, more than 70 years old.
Yeah,
She's
78, 79. Yeah. And
70.
now she's facing, she doesn't have to do radiation, she doesn't have to do chemo, but they want to put her on a hormone suppressant for the next 5 years. So she says, I will be 84 when I'm done with that. And
Yeah.
from all the research, and she's been interviewing people that have taken different suppressed medicine, she goes, I'm not sure. I'm just not sure, particularly when there is maybe only a 2 to 4 chance of recurrence if she takes it.
Yeah.
So the statistics might not be good enough,
And
whatever. But, I mean, here she's trying to make a decision about the post-surgery when I don't even think that she's through the shock of what has occurred, plus the
true.
pain that she's still in.
And does she still have the night sweats?
No, no, I don't
Okay.
think so. Yeah, I don't know. No, she's just got the shock and confusion, and
Yeah.
yeah. So
Ah,
so
And
that's one of the first stages that everyone goes through, is the shock and the fear of what will happen from this, you know.
definitely,
mm,
it's so many different multiple layers of changes to your life.
Mhm,
And
mhm.
before we get into that, I also want to introduce Dr. Deb. So you are acupuncturist who founded a puzzle acupuncture, and
yes.
you have 17 years of experience working in as a acupuncture
TCM.
TCM doctor, and then you also have a family member who is diagnosed with breast
Yeah.
cancer.
Yeah, my sister-in-law was diagnosed last year. Last year. And she's only 33, no, 34. And my brother and her, they don't have a kid yet. So they haven't have any babies, and now they just thought of, okay, we should start a family, and then discovered that she had cancer. And while she was diagnosed, at that period of time, my brother, they live in Taiwan, but at that time my brother was in California. Actually, he was having a scholarship, like he had a 4 months of studies in Stanford. And so when my sister-in-law was diagnosed, and my brother wasn't with her. So of course she was shocked and lonely at all the same time, even though her parents and my parents are with her, but still her husband wasn't there. So she was like really, at that point she was really scared at the same time. And
Mhm.
And for
for
her,
her,
like she's early stage
yes,
when she diagnosed,
Yeah.
and
one is she's early stage, but also she still need to go through all that. And because of that, they they went through the process of getting, like, doing the IVF, just to get the embryos out, just to make
Mhm,
uh, just to have some embryos um, saved for later. Even though, like, probably after now she's done chemo, and now she's doing the hormone therapy. So that's gonna
mhm.
take another 5 years. So when she's like, probably when they really finally having the chance to have the baby, she's gonna be almost 40.
Yeah,
And
and you have
and
another friend who is also diagnosed with cancer, and every time they're trying to have baby, like there's the cancer coming back, and this is like constantly
Yeah.
impacting their emotions, their life. You cannot plan something like this. Like
yes,
you have so much hope, but then every time like it's like
and it also
going,
affects
it's
like
a circle.
it affects their connection with their families. Like my friend's parents, the men's size parents, like the in-laws, they're wishing to have grandkids, but then every time she's trying to have a baby, then the cancer comes back, and she's been fighting cancer for the past probably more than 10 years, and that's really seeing them, it's really devastating because each time the cancer comes back and she almost die, and now she's just like, I'm just gonna take care of myself. I'm not gonna take care of what the in-laws are saying. My life is more important, and now she's having more positive thoughts, and for the past few months, she's pretty healthy, but now it's like, yeah, before that, she was, like, really devastated.
Yeah, and
Yeah.
sometimes those hormones that it takes to get pregnant and to stay pregnant is the very thing is like jet fuel for, for breast cancer.
Yeah.
I've many women who, have gotten pregnant and they've also been diagnosed right around the same time. So here they're trying to stay healthy enough for their baby,
Mhm.
and alive. So
Yeah,
it coincides. It coincides. So,
yeah,
you
and
know, I think it's important to talk about, to be able to say, because so many people, when they're diagnosed with breast cancer and sometimes just other cancers, it's like, what have I done wrong? Is God punishing me? All the different doubts, and it it doesn't make any difference. I know people who had have had no diet changes. Having a very fat rich diet, maybe. Other people have been completely vegan, clean, nothing going on, not, still will be diagnosed. So it I- and it doesn't matter what strata of life that you live in.
yeah,
It happens across all cultures.
yes. It's just so close to us that, like,
Yeah.
before last after we talked last time, I did reach out to my sister-in-law and asking, like, how she's doing recently, and I think, good thing is because we're Christians, and she has a group of friends in church that will pray with her, and then she has someone to let out her emotions. So for her,
Mhm.
it's very important that she has those support friends,
Mhm.
and the families
Mhm.
are very supportive, so, she's
And
recently she's okay.
so this is one of the silver linings of this diagnosis and this journey, is to build your support team, to let family members in, to let girlfriends in, to let extended families. I'm sure on some level, Deb, she was so grateful that you even asked, that you're educating yourself about the impact that this is in her life and in other people's lives.
Mm,
And so that silver lining is, I think there's many people that, they just they're just with their doctors and their medical team, and that's it. But it's very isolating,
mm,
because we need each other, particularly when we get really afraid or we get really not well. We don't feel well. I know that one particular person that I worked with, she had her good friends go to treatments with her,
Mm-hmm.
sat through the chemo, sat through the radiation. I shaved her head in my office, and another woman who she was really into wigs. And so I would look out, my office door to see her coming, walking down the street, and we named them all. And I'm going, oh yes, okay, she's coming today. Oh, she's coming today. That there's many different alternatives to letting yourself have a few personalities underneath your wig
True.
until your hair grows back, and so um and there's humor. I mean, in some ways there is just a lot of humor. I mean, people are willing to say how it is, and not
Yeah,
pretend, you know
true. I think it's really important to have a positive thought and open to it. I remember I had a patient, she had I think she's in her 60s at that time. She had 4 tattoos on her thigh, 2 in each, and that was like a caterpillar on a rosebud, and then it turned to a cocoon, and then the rosebud opened up into a bloomed into a rose, and then the butterfly flew away. And that was she was telling me in the beginning that was she was having cancer, and then afterwards she transformed, and then now she's cancer free. and
Mhm,
and she said the cancer was like a couple years before ago, and then she's just started to have different tattoos of that of what she felt. And she
mhm,
said just like trying to fight it and be positive, and then she's happy and
mhm.
feel she can conquer anything.
Yes, yes. One of the very, very early um, breast cancer survivors who had a double mastectomy, famous writer. I'm not sure she's still alive. Um, and she had double mastectomy with no reconstruction, and she tattooed her entire chest,
Oh,
you know. And it was just, it's like here's my new identity. So
mhm.
let's talk about this identity,
Yeah.
because your identity changes.
Mhm.
For women, it's like going, oh, I'm identified with my breasts. They're a symbol of my womanhood, my femininity. Some women have nursed, not nursed, um, their sexuality, what will their partner think, all those different things
Mhm.
around who am I now? And
Mhm.
I see more women, they're not doing reconstruction unless they're in their younger years,
Mhm.
of just being able to say, nope, this is me. This is my body now,
Mm.
but there is a big identity shift.
And it's quite because just hearing like when you were talking about the wigs, and you also mentioned like before like people would tattoo their eyebrow, like trying to find the
Mhm,
fun from it, but just the fact like your appearances change, like you are losing your hair, you are losing your breasts, like those are, as you said, like symbols of woman, like a lot of people associate that with who
mhm,
they are. And this is
mhm.
something you have to deconstruct about, okay, who am I now, and
Yeah,
how can I go from that identity, from the day that I got diagnosed.
yeah, yeah. And all those things don't come in order. You know? I mean, you think they come in order, but at each juncture, I mean, not every single woman or man is going to go through a full mastectomy, you know?
Mhm.
Um, many many might have just a lumpectomy,
Yeah.
and not even radiation or chemo. The treatments are so individualized at this point, and the genetic testing is so amazing. So
Yeah.
I'll tell you one story. I mean, it has a sadness, but a good story to it as well, of working with one woman who w- had the amazing different wigs. I mean, it was so much fun to see who she was going to show up as. But her father, so she was a BRCA carrier, and there's BRCA1 and BRCA2, which is a genetic makeup, which has a possibility that if you are a BRCA1 or BRCA2 carrier, that you might be predisposed to
Mm.
cancer, breast cancer, uterine cancer, lung cancer, just different cancers. Her father was the carrier. And so when she was diagnosed, they went ahead and tested him. He was the carrier, she was a carrier, and then her younger sister was also a carrier.
Oh.
So, as a gift to her sister, during that time, who was in her 20s, her
Mhm.
sister went through a radical double mastectomy,
Oh.
along with having her uterus removed and
Mhm.
fallopian tubes removed.
Mhm.
She did freeze her eggs before,
Mhm.
she did this. So she survived. And I think she might have gone on to have her eggs carried by another woman.
Uh-huh.
I'm not sure. She married in her late
Mhm.
20s. And yes, her father and sister did pass on, and very close to one another, but it was an incredible deep connection that I had with her in this family,
Mm.
because um, there was a knowing of how the outcome might be, and that the trials just would not touch it. But the sister then survived.
That's that's so nice that she saved her sister.
Yeah,
Yeah.
yeah.
That,
And like maybe we can share about the impact, like for someone who don't know, like what would the when this happens, like usually what would happen to their body, like um
Well,
when
as I see it, is that when both men and women go through, breast cancer treatment, they have a lot of choices of how they want to go through it. Some actually say, I'm going to ride it out. I'm going to use alternative medicine. I'm going to see which way it goes. Um, I haven't seen that go so well all the time, but you know, Deb, that, this
yeah.
blending of allopathic and alternative, and you being so knowledgeable in
Yeah.
acupuncture and Chinese medicine, is there's that choice of, again, each one of these choices is individual. Some of the things that are happening now, depending on the diagnosis, I'm not going to go through all the diagnosis because I'm not a physician, and I don't want to misstate
Mm.
something that isn't right or offensive. But there are certain layers of diagnoses that need certain treatments. Early detection is the best way to go. And then if you do choose to have a mastectomy, lumpectomy, mastectomy, then I mean, you're sacrificing your
Mhm.
body parts,
Yeah.
in many disease process. I know people that they get a kidney from somebody. It's like we're in a time in medical history that we can actually do this.
Yeah.
Some people, women in particular, who have breasts, men have breasts, but there's not that much to reconstruct, not
Mm.
as much to reconstruct. For women, women then can choose, do they want to reconstruct their breasts? And so that's additional surgery. So there's a lot of sacrifice, of the body. you know, and sort of a surrender to go through it.
Yeah.
That
And
sounds quite overwhelming because it's, as you said, it's not just like there's a timeline and the things happens, and it's so much choices you have to make
mhm.
about your body, about your organs, and it's
And
like
you know, the
it's such a
organs are
mix.
on the inside, you know, the
Yeah.
organs are on the inside, your breast is on the outside,
Yeah.
you know, and thank goodness we have so many resources for, you know, prosthetics, you know, women who don't want, you know, to reconstruct, but there's prosthetics, you know, there's swimsuits, there's bras, there's everything you need that will, you know, help with that. I
Mhm.
know that I'm thinking of one particular woman, student of mine who, you know, just um, gorgeous woman, very large breasted, and so she was diagnosed, and she just says, "Oh my God, take them both." You know, I don't want to provide a host, you know, for this to come back. I don't want to go through this again. And she did not reconstruct. You know, I know so many women who don't reconstruct. They just go, why? You know, why? You know, I'm kind of done with that, you know, but women who are younger and still, you know, they want the vanity of their body and that familiarity will go through that, and they'll go through that well and beautifully, and it works,
Mhm.
you know. So there's identity choices all along the way. Plus, you know, having to live with scars
Mhm.
and also some women, particularly that you've tested positive, men, you've tested positive for BRCA1, BRCA2, of going, oh my goodness, let me be responsible for my children, you know,
Mhm.
and because it can go to men as well as women, and how to make sure that that is knowledgeable. And I think that that is suggested so much more now. Is, are there other family members that you want, you know, to inform? Because the other thing that happens is that women will go, okay, I'm going to do my breasts, I'm going to do my breasts, I will reconstruct them, then I will give up my ovaries and my uterus.
Mhm.
So it's not just step one, you know,
It's yeah, it's really a lot. And
it's a lot.
like the patients I see, yeah, it's not there's side effects from chemo or radiation, and even with the surgery, there's like limitation of movements, or because of the
Mhm.
scar, or like some you might have like neuropathy, or they have tinglings or numbness on the fingers. Like anything can happen, and yeah,
Well,
we
the lymphedema happens, you
yes, and
know,
also
yeah, and
with the
so
swollenness.
yeah. So it's often that then you need to find someone, you know, a PT that will help with a lymphedema, and train you how to release that. And also, if you're going to be in an airplane, you're going to be in a sleeve.
Yeah,
So
yeah,
little things changes, like all
Yeah.
you
So
you not everything.
there's just always one more step, you
yeah.
know.
How and you mentioned like about like working with PT, working with different departments. Like how would that usually work when this happens to someone or like your family members? Like how
Well,
do you
if I
build a support team around you?
well, you know, I mean, sometimes I'm in from the beginning, because I mean, I'm thinking back because we had a breast cancer specialist who would refer patients to me. And so, and I also have oncologists that would refer patients to me if I got in on, you know, at the beginning,
Mhm.
you know, or somewhere along the line. What is also, mm, I'll go back to that. And so it's building the relationships with your healthcare workers.
Mhm.
And who do you want to be with you? For some
Mhm.
people, it can be more traumatic than others, for whatever reason. I'm thinking about one patient that I worked with a lot, that she had a lot of early childhood hospitalizations for asthma, and so it was like she was traumatized by being in the hospital again, and also being a patient, i.e., victim, feeling that all that early experiences, traumatic experiences, were re-entering her trauma treatment.
Mhm. And like, like in
I don't think
Chinese
I
medicine,
answered that. I didn't answer
no.
that question completely, but to bring your team together, build your team, build your tribe. You know, I also see that people have, there's more support groups. There's actually, when you're more through the treatment, there oftentimes are gyms that support just people working through, breast cancer, because it's it's so deep in the muscles, so deep in the structure of our physical bodies, to build your strength back.
Yeah, like the the patients that come to you, would you trace back to their like not only from like the trauma that like they got from diagnose, but do you trace back to even earlier, like you said with this, she was having
Mhm,
childhood and
mhm,
she'd been
mhm.
going to the hospital during her childhood, and like do you feel like in Chinese medicine, we think that a lot of cancer conditions, especially with breast cancer, it's related to um, they have anxiety or depression, and with we say that it's like the liver energy stagnation that will cause the
Mhm.
stagnation, and like the dampness or the qi will be stagnate, and that will cause cancer. So it means that before you got diagnosed that having cancer, you might be already a grumpy or a very easily depressed person. So that's why some okay. So I'm asking because when you have these patients, if you trace back, do they have these um, like kind of signs of being depressed or before being diagnosed of cancer? I know we said that it could happen to anyone, but is there a higher level of that could might cause it
Is there a reason it
to happen?
happens,
Or
and like should people feel shame about it?
yeah,
Like,
probably.
Yeah, I always take a good history, particularly around, traumatic events in people's lives, and don't take this as a generalization,
Mhm,
that this is for everyone, but there does seem to be some early childhood neglect,
mhm,
abuse, um, unstable families,
mhm,
you know, early losses, things like that, that can happen, or very, very deep
mhm,
suppression.
mhm,
So I will be personal here, is that my own mother died of pancreatic cancer at 60, and
mhm,
I would say it was a good amount of suppression. I mean, this was in the, let's say, the 80s, early 80s, but she was raised, in the 30s, 40s, 50s,
mhm.
where, women didn't have that much of a voice,
Yeah.
or a way to really be in the world,
Mhm,
and so I think that that's, a lot of what happened for her,
mhm,
besides, um, maybe too much, alcohol and nicotine, which was part of that culture,
mhm,
I mean, it was like, that's just what was going on in the 50s.
Uh-huh.
So you had your cocktail, and that's what was happening. you know so so that for me, that I've had to put together is the suppression, that there wasn't a place for creative use of emotions or creativity or expression or help.
Mm.
Help. Couldn't do that. I mean, we still have trouble,
Yeah,
asking for help. And that's one of the positive sides of this, is that you do ask for help, that you can't do it alone. We can't do it alone anymore.
true. And it's good thing that people now are more open to go to a therapist to talk about whatever there's going through, and there's an outlet for
Mhm,
them. Yeah.
mhm,
Um, yeah, and like we talk about like how like yes, there is such a huge silence, and that it often comes with shame. And I mean,
mhm,
it's partly genetic, you partly it's like the lifestyle, something could happen like early childhood, but like the I think that just the amount of shame, like and that's also blocking people from asking for help. And you are at a position where like everything changed physically, mentally, your family dynamic. Are you going to have kids, or like a lot of it's impact in every other way. But like how like first is like I think I wasn't aware before talking to Elizabeth, before talking to you, like there is so much silence, like
mhm,
around this subject.
mhm.
Like this is like how did it happen, and how much people are trying to avoid this subject even.
Mhm. And you have to, also appreciate that when this diagnosis comes, it tends to be out of, it's inconvenient. I mean, you may be on planning a very big journey trip, and you have to wait until you get home to get the diagnosis, or things get disruptive, and it really is uh at 180. You just your whole life changes.
True.
And I know so many women that they've got young children. you know they're trying to keep their profession going, if they've got their profession happening. Men aren't going to talk about it at all. I mean, this is a woman's disease, right? No, it's like it happens, and then men go, oh, how did this happen? But you look within the genetics, sometimes that there's just enough there, and maybe a lifestyle or early traumas can contribute to it, you
Do you
know.
have do you have lots of men clients that come to you that had, like, breast cancer?
Not very
Mhm.
often, occasionally, you know,
Mhm.
occasionally. They want to keep it to themselves, or, share with their wives, keep it within, the medical model.
Mhm. Mhm.
Yeah.
I think it's
So,
really hard for it's even tougher for men to open up, especially with they have breast cancers, and yeah, I
mhm,
never had,
or
any
cancer.
patients with that.
Yeah. Yeah. And, even with, the surging of prostate, cancer, it's sort of like sometimes men's journey, of that they get prostate cancer, women get breast cancer, you know, and there's a lot of shame. There's just a lot of shame, a lot of secrecy, you
I
know.
think
Just want to make it through.
my dad actually got diagnosed with prostate cancer earlier this year, but,
Hmm.
and he's also 79, but
Hmm.
well, he had, like, colon cancer a couple years ago, but he gone through it. It was okay, and this is not related to his colon cancer. So the doctor said, as his age, they don't recommend to do a surgery. And he took 2 shots, and the levels went down. So it was
Right.
like okay, but like he did talk this. He was talking to his friends and then chatting about this. And like with his age, this is like quite common with prostate conditions, and some turn into prostate cancer. And so he
Mhm.
had other friends um, did the surgery, but the outcome didn't came out really well. So they were just chatting about it. So I feel so from his case, I feel like, oh, he he has a much open mind about talking about this through with his friends, and they don't mind talking about it as well. So
It's great. It's
yeah,
great. Yeah. Yeah. And, if you're, y- um, there's a couple other things that I'll mention is and I did it in the beginning, but I'll say it again because I had a colleague who's one of many children, and she was diagnosed in her 60s. And once that was happening, it was found out that her aunt had breast cancer, but it was never spoken
so
of.
open.
So, that genetic testing could have been done,
Yeah.
and it is happening more and more and more, particularly, for people who have children, or siblings.
Mm, yeah.
So when, Jenny, you're talking about, the secrecy or the silence, it's like people just kind of go, oh, I'm just going to take care of it myself, and it does impact other people,
Yeah.
and um, so,
Yeah, totally. I think when I know about your dad's like diagnosis, I was surprised like how light he felt, like
Yeah.
even after like getting
Well,
it,
he's
and just like having a very positive like attitude towards it. It's like it happens, and but I'm just going to go through it, trust the system to just like
well, they were a bit worried in the first few days, but after the doctors tell him like his the level he's having, it's not as serious, and there's not really a tumor. It's like it's like a very tiny dot. They
I
think
see.
it could be cancer, but it could not. So
mhm,
they thought that not doing any surgery, just to do the
I see.
injection,
Yeah.
and that went down. So for him, he's lucky with that.
mhm.
Yeah.
Yeah, early detection is really so important, and I can't tell women and men, please see your healthcare provider, you know, have your
Mm.
prostate checked, have your mammograms, do your own breast exams because the early detection, like my friend who was just diagnosed and went through surgery within 10 days, she had no idea. She was just having night sweats,
Yeah.
no idea that her life would be altered,
And
and her breast didn't feel any different, so it's and people are going, "Oh, yeah, it's been 5 years since I, had a mammogram," or it's the same with, "Oh, yeah, I had my teeth cleaned, 5 years," I mean, people don't do healthcare. They just don't.
one is also, but the healthcare is so expensive in this
It's so
days.
hard on us. It's so hard on us, all at the same time, you
Yeah.
know,
How
and
early, like what age, like, and how often should people go to
Well,
through these checks?
when if like for a mammogram, for an ultrasound, you should do it after like your 30s, and then for a mammogram, you can like in like for example in Taiwan, after you're 40, you can get to do the mammogram probably every year
mhm, yeah,
just to check it out,
yeah. I'm
and
still doing a mammogram every year.
yeah.
and
just to
I'm
be safe.
yeah,
And
you know,
and sometimes
so
I did find some nodules, but it's just benign, and then you don't need to
mhm,
worry too much.
Mm.
But just to be
Mhm.
safe. And
yeah.
I also did a gene test after my dad found out he has a colon cancer, but I think my genetic, I don't have that like the gene that is bad. So I think it's fine,
Mhm,
and just
mhm,
eating cleaner should be okay. But
mhm,
yeah,
And
mhm.
besides doing those tests, there are self-tests too, right? Like you can kind of like check
check.
your breast to
Yeah,
feel if
if
there's
there's a lump.
lump or not. So there's
Mhm,
plenty of like just like something that like simple that people can do at home.
Yeah,
mhm,
yeah,
mhm. And, it's not uncommon that some women say, I just have, kind of chewy, thick breast tissue, so I can't feel anything, and so it's the mammogram. And now we have an incredible technology. And that's how actually I was pulled in as I was on an advisory board for women's health, and we were fundraising for the 3D tomography.
mm,
Where you can look at the whole breast like it's a, it's just, I
yeah,
don't know if you've ever seen it, but it's so amazing to be able to look at all these different,
yeah, from different
directions.
angles. Yeah,
Yeah, and so that once that 3D tomography really, um, came on board, which now most places have, but it was, during a lot of that fundraising and keynote speaking and educating people and being able to hear women's stories, because women and men have a lot of stories, and it's what saves us.
yeah.
And going through this, like, what are some of the, I guess, if we put it in a lighter tone, like, can people find goodness or benefit from, like, going through this breast cancer? And what are they?
Well, I think the first thing is it's very humanizing, and there's also something about going, oh, wow, I'm suffering in a completely different way, but it's somewhat real. It's very real, you know, is there's a way that of course, you're working with fear a lot, fear of which way is this going to go, you know and so being able to learn how to meditate a little bit, walk in nature, be in nature, appreciate what you do have, appreciate the connections that you have with family, you know
Mhm,
and it could be just one girlfriend, it could be one one particular group where people are talking about, the challenges that they have. So, there's writing groups, there's dream groups, there's, um, you know, women are, let's go, horseback riding out on the beach, all cancer survivors, there's lots of opportunities to begin to really appreciate your life and be grateful, and you make really good friends on the most part. That the what was I going to say? Um, I, there's a garbage can being brought up in the air right now. Distraction. Um,
No, I think
that
like
your
what you mentioned.
caretaker, that your caretakers, are helpful and they're kind.
Yeah.
And particularly when, there's depression and anxiety and stuff like that, that you can get some help and support for that. And your
So
therapist means everything to you. Let me tell you. It's been a privilege to work with people through their cancer.
so it's almost like knowing the fact that there might be a chance for like so close to death, because that's what people they will have that in mind,
Right.
that you learn to live again because
Mhm.
it's so close, and then
Mhm.
reevaluate and then looking like it's like knowing what's more important to you. Like,
Yeah,
Mhm.
just cherish your
Mhm.
life more than
Yeah,
ever.
and things happen where you just go, I wasn't liking that job anyway. It's like going, okay. I mean, it can be a pivot, a positive pivot. Of some women will go, oh, we're going to go ahead and get married. It's like, yes. Or you know um after some time, I'm going to adopt that child. There's choices that can come out of it that are really positive.
Mhm.
I'm going to go back. I'm going to start dancing again. I'm going to begin to paint. It's like those questions that maybe you have put off, it brings it right in front of you.
Yeah.
it's like a chance to do the stuff that you've been putting off, or like
Mhm.
doing something that you never do, and it's almost like a new life,
Yeah,
like you are
a
giving a
new
second
life.
chance to live.
Yeah,
Yeah.
yeah. I mean, I've known some people, they've sold everything and they just go, up, I'm going to go around the world, you
Wow.
know, or they've moved, they go, oh, I don't want this old house anymore. I want to downsize. I want to live close to my grandchildren because my grandchildren bring me life. Or my siblings or my parents. There's sometimes a really important choice about maybe some part of your life that you've been putting off.
Yeah, because you might think there's just a limit of time, and then you want to
Mhm,
do more, and
mhm,
yeah,
mhm.
Yeah,
Yeah.
bringing people to
unfortunately,
the presence.
yeah.
Yeah.
Mhm,
But actually, probably after your feelings or your mind got pivot, or then it also helps with the positive energy. It helps you to live even longer than you can
mhm,
imagine.
mhm. And a reason to live.
Yeah, good.
There's been people that I've worked with that it's like going, oh, they've been in remission for 20 years and something will pop up. you
Mm,
know and that is true of, cancer patients, or kind of like, oh god, I've got this feeling over here in my body here. Oh, is it what? Oh, what's this? There's always a little bit of what I would call hypervigilance, where you're sort of looking out for so many signs. Oh, is it back? And that 5 years is such an important marker,
mm,
for cancer diagnosis and treatment and recovery. That's
yeah,
why oftentimes physicians will put patients on,
the
medicine post.
yeah,
What's so significant about the 5-year marker?
I think if you think back in your life, a lot of 5-year markers are important.
yeah.
5 years since this, 5 years since that. Oh, been married for 5 years. Oh, phew,
Mm,
okay. Divorced for 5 years. Whew, you know, the child's five. There's just something about 5-year
yeah,
marker in particular in breast cancer.
And you mentioned like the length of that people have to think about, like it almost like the hypervigilant. You have to constantly notice little bits parts change about your
Little,
body.
yeah.
But also it's like it's not just like, oh, I go through this chemo and then it's done. It could be
No,
like
it's not
20
done.
years. That's like your whole life.
Yeah.
It's
Yeah. And in the post surgery, post treatment, if you go that way, you're going to be on every 6 months, every year. You're going to be, tested, markers. What are the markers? Some women and men are going to go through, you know, um, contrasting PET scan, to make
mhm,
sure that there's nothing else in the body. you know
yeah,
um
And
So,
it's almost like changing a lifestyle. You learn to live with it. Like it's part of
mhm,
you now. And
mhm.
it's like maybe after 5 years, it's a celebration. Like, and then like
Yeah,
like it's still it's okay. You are going to be okay. Like
you're
whatever.
gonna be okay. You're gonna be okay for now. I mean, everything you know, you're gonna be okay, and things can reoccur in different places. Breast cancer sometimes is just one of those one like prostate cancer, but breast cancer is one of those ones that likes to jump ship and metastasize in other parts of the body.
True.
So it just happens.
And I guess like if we get a bit philosophical here, like it's not that if you are diagnosed with cancer, then your life is uncertain. Like in any cases, you don't know like what's going to happen in your life. Like
Mhm.
people like you don't know how long you are going to live, but then like having something is just putting things in perspective. Like, oh, there is this reason, but if we even without that, like life is that it's just like most people going on with their life, like um not having to think so much, dealing with so
Right,
much about
right.
that.
Yeah, and, breast cancer, other cancers, certain disease processes, let's be honest, we all have a ticket on the train.
True.
We're not gonna get out of this life not dying. This is what happens. But for people who've maybe gone through really a lot, I'm thinking about my dear, dear patient, people that I've sat with, in their, you know, in in their dying time,
Mm,
what I say is I go, "But their ticket is punched,"
mm,
Mm.
in a way, and I've had just some amazing. I'm thinking about this one particular woman who I just adored, she had so much humor about who who could and couldn't come to her memorial, you know, and because she was still really, really mad with her ex who sort of dissed her, you know, and she nah, nah, he can't come, you know. And though there's some way where there's just a very, very deep humor that can happen because what what else can happen? Really. There's something so human about telling the truth and then kind of laughing about it,
Yeah.
yeah,
you know.
it's a humor, but then it's also truth. But like just sometimes the truth is kind of funny because it's like so hard. But then if you
Yeah, it's so
switch
hard.
the attitude, like
Yeah.
you
Yeah.
that's a way to go through.
Mhm. Mhm.
And I think at the end, I want to to ask like, if this happens, like what can people do? Um, like is there any resources? I did a bit of research, and I know like for example there is like a lot of groups people can join, like National
Mhm.
Cancer Foundation. There's a lot of nonprofit and locally, but also for example in Bay Area there's UCSF have cancer support group, Bay Area
Mhm.
Cancer Connection. There's a lot of like
Incredible.
resources that
Right.
I think
Right.
Elizabeth, you mentioned like local gyms, all different like facilities. They might have like groups that supports
Mhm.
cancer. You just need to like look for it and reach out. What else that you know
Well,
that people
I
can do?
think that there's also, within the medical model, there's also alternative medicine groups,
Mhm.
so that there's groups. Sometimes I know that there was a time when I was thick in it, is that you get free acupuncture, you get free massage, you
Oh.
get, lymphatic lymphedema massage,
Mhm.
haircuts, gym, it's like going, there's a plethora, but you have to not just sorted out, but most hospitals have what um, is a nurse navigator that will help navigate some of this, and
Mhm.
will have those resources,
Mhm.
you know, and how important it is to be received,
Mhm.
of going, oh, okay, there's going to be a writing group just for women, or people going through breast cancer, or a yoga class,
Mm.
so you can reacquaint yourself with your body, or
Yeah.
certain people who are going to massage you, you
Mhm.
know, that they know how to do that, and they don't have any shame about touching your body,
Mhm.
you know. And then I think there's such a huge need for, couple therapists that will help the couple, navigate, what it is when your partner is going through this, and the whole identity change, you know.
Yeah, because
Yeah.
like it's definitely impacting the couple, not just the
The couple,
woman,
the
the
couple,
man.
the
Like
family,
you want to help, but you don't know what to
children,
do. It's
the
changed the
children.
dynamic.
I mean, some people, actually, um, you know, have guilt of, I was going through cancer treatment and my child was 6 months old or two, and I just couldn't give that child what they needed because I was trying to save myself,
Mm.
So, it's many layered, and for women and men to have places to be able to express and go through the layers,
Mm.
Yeah,
and to thrive. I
Yeah.
mean, there's the survive, but to thrive.
True. It's very important.
what
Yeah.
about from your perspective?
From from well, with TCM, what I used to do, it's we wouldn't encourage patients just use traditional medicine, because with the technology now, of course, we work hand in hand with the Western medicine. So whatever they need to do, surgery or chemo or radiation, we work with them. And there are certain ways and certain stage that what we do, either acupuncture or herbal medicine, like throughout, if they have pain, we use acupuncture to um, help with their pain.
Hmm.
And if a lot with the side effects like feeling nausea, vomiting, or like feeling fatigue, um, if they're open with herbal medicine, like especially in China, we use herbal medicine a lot. And
Hmm.
um, because if they're having cancer and going through like chemo, we know like which herbs to use, not to contradict with their medicine. And also if they're during their like hormonal, like doing hormone therapy, there are herbs that will affect their hormones. So that's when we need to put into consideration what to use to avoid that. And
Hmm.
usually with a lot of doctors in Beijing, they do treat cancer patients, not only breast cancer, but all sorts of cancers. And with different types of cancer, we have different protocols. So we'll see what their
Hmm.
conditions are, and that's what we do
Hmm.
usually. Yeah.
Yeah, so that's like so there's like alternative medicine that can help to impact the side effects. There's psychological, like from psychotherapist perspective,
Hmm.
have a lot of tools that can help patients to deal with like how their identity change, and how
Hmm.
the impact on their family dynamic. And then you have a lot of different other alternative medicine, and also like Western medicine that can all
Hmm.
comes in to help. And I think like from the patient perspective, like asking for help and realizing like this is something big, and then you do
Yeah,
have
very
a lot
big.
of resources,
Yeah.
like that,
Yeah.
like
Ask
Yeah, there's
reaching out for
Yeah.
help,
yeah,
that's
there's
important.
one more thing that I kind of put aside that kind of came back here, is that when I'm thinking of one particular patient that I worked with, is her crisis came when her treatment was over
Oh.
because she was in relationship to all her caretakers.
Uh-huh.
And she was a patient. She knew herself as a patient. Here's I'm gonna, get ready for, um, surgery, and then I'm going to do chemo, and then I'm going to do radiation, and then I go for every 6 months, blood tests, markers, how's this going, her first mammograms, things like that. But her crisis was, who am I now? I'm not a patient anymore. Who am I?
Mhm.
And that was a whole opening in me of going, it doesn't end, and that everyone has their different junctures.
Mm.
It
So,
doesn't end. And you mentioned like before you work with someone who after 20 years, like they
the
recover from
recovery.
cancer, but then after 20 years doing some tests, then you find out that they had cancer 20 years ago. So it has very profound impact. And
Yeah, it's like, what I may be working with somebody in my practice, and they didn't come to me for cancer treatment, of any kind. It's not like a physician or an oncologist or something sent them. They just came to work on some other things. And
Mhm.
along the way, it's like going, oh yeah, I had breast cancer, da 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 and da da da. And I go, well, how are you with it? I mean, does that feel pretty clear for you? And some say, oh no, it ended my marriage, you know, or it was the worst time in my life, or you know, um, I feel so blessed, and some women said, I feel so guilty because I got away with a lumpectomy, and other women didn't. So what am I supposed to do with
Mm.
my guilt? So
Oh,
it's. Yeah. So,
so it could
so
be
anything.
anything. Like
anything,
Mm.
anything, we are complex human beings.
So how do you deal with that guilt because she got away with that? Like
That
she's
was a
lucky.
that was a total surprise.
Yeah.
It's like, oh, my sister or my friend or something, they didn't get away with that, but I just had a you couldn't even tell that my breast is even any different. And so it's like, it's in some ways there's something about accepting our own, I don't know if you've heard this in China, our own lot in life, our own journey.
Uh-huh.
This is your journey, that was their journey.
Mhm.
And just that you have guilt, is that you feel that compassion
Mm.
for everything that this, maybe your best friend or your mother or your sister or somebody went through.
Mm.
you know
Yeah.
that that I have seen, on the most part, it's an opening. I mean, just to hear that your father's sitting around with other men talking about their prostates, it's like going, oh yeah, it's like you want
Yeah.
to be a fly on the wall for that conversation,
Yeah, he just told me like it's like nothing. Just like, oh, that his friend who has that same condition, and he was just telling like sharing his experience to others. Like I went to this doctor and then did this, and now I'm okay. So probably you can go check again, and he feel like he's an expert now.
yeah, yeah.
well, I think that's a great like ending, like which we end with like the fact. Yes, there's a lot of there's a lot of resources you can
There's a
reach
lot of
out, but
resources.
all that it doesn't mean like you're going to have the same experience like anyone else, and there's the
Right.
impact on like on you. It could happen in the when you first diagnosed, and you are going through many different stages. Everyone is going through a very, very unique and a
Okay.
personal experience, and
Mhm.
that nothing is wrong. Like you can feel anything, and
And it's
it's
always changing.
human.
I mean, from when I was first, in this field working, with breast cancer to where it is now. I mean, it's like everything is different. Oh no, we don't do that anymore. Oh, that
Mhm.
no, no, we don't just do mastectomies. No,
Mhm. Mhm.
um, it's just different. It's ever changing.
Yeah.
Yeah, you mentioned like, oh, the procedure changes, like there's new
Technology.
technology that's supporting
Hmm.
it. So
Hmm.
it's hopeful at the same time, like we are open to experience a very unique
Hmm.
personal experience.
Yeah.
That
Yeah. And the targeting, depending on what the diagnosis is, and again, there's many different levels of diagnosis, just that whole part of being able to target, with, oh, we're going to use this combination of chemo, you know,
Mhm.
um, the whole field has changed and become so much better.
Mhm.
And treating, I mean, we're still treating a lot of cancer, not just breast cancer, a lot of
Yeah.
cancer. And we're just hoping that it's just going to get better and better and better.
True. Yeah.
And the resources are there, and the silence. We don't have to keep it between the four walls, between just our doctors and ourselves, and that we actually become advocates. And then the good news that I see is that women and other people, they talk with one another. Oh,
Mhm.
what happened to you? Oh, what was that like? And how was this? Is everyone's got their own story. And, we become more part of a community.
Mhm.
and the sharing your personal story, like being vulnerable, is a way to
Mhm.
be strong.
Mhm. And becoming advocates, like this woman who just got diagnosed, her particular physician or her particular, hospital or whatever, don't have a lot of resources. So now I want to, hook her up with,
Mhm.
someone or a few someones, of going, okay, here's some possibilities,
Mhm.
so she
Yeah.
doesn't have to feel so alone.
That's
Yeah.
wonderful. I think like there's a lot of resources, but it's also too much information sometimes. So like
Mhm.
talk to people, like it's try out different, just see what works for you. Cause
Yeah.
like it's very personal. Like you have the experience is personal. Also the treatment should be customized. So
Mhm.
like
Yeah.
yeah. But thank you so much, Elizabeth, for
No,
joining
thank
Yeah.
us.
you.
Thank
Thank
you,
thank
Elizabeth.
you for finding me. I mean, it was like, you know, a needle in a haystack in the middle of LinkedIn. And
Yeah.
to meet the two of you has just been quite a joy.
No,
Like
this for us too. We're really grateful that we know you now
yeah,
and
and
meeting you and by all every time talking to you, it's very inspired and very touched.
yeah, it feels
Yeah.
like it gives me kind of like, oh, this is why we want to do this, because we want to talk to you and to learn
Mhm.
about just like stories with you have such a rich experience, and
Yeah.
you want to help people. So that's like something that's just like touches me.
Yeah.
Yeah. And that's what the two of you are doing by forming your podcast, is to
Yeah.
try to get it out, try to get our stories out.
Well,
So
we're
I
trying to
commend
do
you
that.
as well.
Thank
Thank
So,
you.
you.
Thank you.
Thank you.
I'm going to end this streaming.
okay.